I want to tell you a story about trauma. Not trauma in the orthopedic sense of bones being injured, but trauma in the wider sense of what happens to our nervous and immune system when it has been pressurized and stressed for long times. This is a patient, let's call her Karen, and she came to my clinic a few weeks ago. In her mid-50s, struggling with chronic pain, struggling with an inability to manage the pain despite being on multiple strong drugs, including opioids. She's had surgeries that haven't worked for her back pain and her leg pain. She's having pain in many other parts of the body, and she's also having other diagnoses of irritable bowel, of headaches, of migraines. But there she was in her mid-50s, unable to meet my eye, sad, crying, and not knowing what else to do next to look after herself. Her family situation is also difficult with 2 children who have special needs and a single mom. And what I want to talk about is the trauma that Karen's nervous and immune system has struggled with, and that is changing and forcing and enhancing a chronic pain. This is something we need to talk about because this kind of trauma is ubiquitous, is very common. And indeed, when this kind of trauma on the nervous and immune system occurs right from childhood, we have a term for it. It's called adverse childhood experiences. And the data is there to say that when you have 4 or more adverse childhood experiences before the age of 18, you are 3 to 5 times more likely to have heart disease, cancer, autoimmune conditions, and indeed even die 20 years earlier than someone who has had no such adversity at all. So what is that kind of trauma? That kind of trauma is something that happens when your body is not ready for it, when you did not have any control over the situation and you are unprepared for it. Examples, well, the adversities in childhood can be around abuse, can be around neglect, can be around various forms of family dysfunction like separation of the parents, like witnessing your mom being physically beaten, like having mental health issues or alcoholism and other issues at home. It can be adult forms of trauma like microaggressions in the workplace, bullying, road traffic accidents, major surgeries, bereavement or shock, and ultimately even things like loneliness and isolation. All of these are traumatic events that every healthcare professional needs to know in order to support their patient. I'll ask you a question. If this is something that you've had, have you ever experienced chronic pain which may have had various examinations and investigations and nobody's found the cause why? Did you know that there could be a relation between the kinds of stress on your nervous and immune system and the presentation that you have now? Isn't it right for every healthcare professional that looks after you to be aware of it and to be able to respond to it? Do you not think that this should be something that every healthcare professional asks, like the way they ask you if you have an allergy or what your hemoglobin is? Because that's what I think should be the way we look after patients. Realize that trauma is extremely common. Recognize the signs and symptoms of a stressed nervous and immune system. Respond to it not just as one health professional, but as a whole system, a whole healthcare system. Because ultimately, we want to prevent re-traumatization, and that forms the 4 R's, which is realize, recognize, respond, and prevent re-traumatization, the foundational principles of trauma-informed care.